Congratulations! If you're here watching this video, it means one of two things. You're either accepted in multiple schools or you're thinking about applying to dental school in the coming spring. Either way, congratulations, you are soon to be in the wonderful field of dentistry. So this sort of topic is very hot. A lot of people want to go to the best school. They want to make sure to get the best education. And if you're fortunate enough to be in this cycle and receive multiple acceptances, you must have this sort of dilemma. Which school do you go to? Right now, I'm going to put a list of different things and criteria that one could possibly think of to pick which dental school they want to go. I'll let you take a look at those choices on the screen. And I want you to pick two of the most important ones in your opinion. So for mine, the top two most important criteria in picking dental school is actually number one, location, and number two, cost. So hear me out. Location is super important because if you're very specific on where you want to end up, it's only natural to go to a dental school that's close by. Not just because you're close to friends or family, but because most of your connections and easy connections that you gain from your time in dental school is happening then. And so it's natural and practical for you to go to the dental school, make connections there, know people, know potential job openings, and then go practice in an office where you gain that connection. So location is very practical, and it's beyond just like friends and family. It's actually really important for a career. One of the toughest things when you're starting out as a new dentist in a new city that's completely far away from your dental school is to learn the area. You don't know how saturated things are. You don't know where there's a good place to live, the commutes even, and even just the demographics of your potential patient you wouldn't know. So there's a bigger learning curve if you go really far and away from your dental school where you learn a lot of the area and potential connections with people. So number two, I would say, is cost. Now, this might be surprising. I know for a while I was advocating just go where you want to go and don't worry about cost. But now, from what I've learned from my experiences, it truly does make a difference. If you have a school that's less than $100,000 compared to a school that's $400,000 after graduation, plus the interest on your loans you have to pay off, it is a big difference. If you still get the same degree, you're a dentist, the money that you save from going to a less expensive school is significant. It's enough to buy or put a good amount of money into your first practice purchase. It is significant. It's certainly a big commitment to pay off large sums of loans that will take years to pay off. And in the end, you're okay, you're a dentist, you're in a great profession, you'll be able to pay it off, but having the luxury and the freedom of mind, not having to worry about that long loan repayment and having the ability to kind of use that money, save, so to speak, to put in and buy into practice is a big difference. Now, Kevin, you're probably asking, well, you've been advocating Michigan and about how great they are, and you're thinking, I want to pick the best school possible. I'm willing to go to the very fine details. Well, if that's the case, yes, there's actually a pretty big range on the schools and your experience. That's very much true. And if you're actually looking beyond just becoming a dentist, then yes, there are actually some factors that I would actually recommend for you to look at. Now, I can't put the order of what's important in the next few criteria just because each person is different. I'm going to talk about them and you can kind of pick yourself which one's more important, but at least I will help you find what to look for and the questions to ask. But all in all, as a reminder, If your main goal is to become a dentist and you want to practice in a very specific area, just keep in mind that location and costs are more important. So the next set of criteria I wouldn't consider in your process of finding the absolute best fit for you. I'll mention the more important ones in a moment, but I'm listing these first just because they're commonly asked. The first one is the chance of getting into a specialty. I'll tell you right now, if you want to specialize, you can specialize and get into a residency no matter which dental school you school. Yes, there are historical dental schools where a lot of people specialize, but that is a self-fulfilling prophecy. You go into school with that mindset, you're filled with classmates with that mindset, so it's self-fulfilling for you to be there with a mindset, go with people with that mindset, and to ultimately specialize. But I tell you that you have just as good of a chance to specialize at any dental school. And that kind of leads on to a similar idea as far as reputation. First of all, a lot of this reputation is based on undergrad rankings. I know there's rankings now with dental schools, but the undergrad rankings are the ones that are very popular and heavily used and popularized in the media, the US News and World rankings. But dental school is very different from undergrad. Maybe there's a slight association at some point, but overall, I would kind of put those all aside. You can't really associate an undergrad ranking with a dental school. It's a different animal because there's a different set of criteria that you have to look at between an undergrad college and dental school. So there's no correlation with reputation and being able to get a great dental school education in whatever way you want it to be. It's very specific, and it's not always the case, even with the current dental school rankings. That's why I made that video about Michigan. Do they deserve the #1? And my answer was yes in that case, but I'll tell you now that you have to go one by one and really see. Number 3 that I wouldn't really consider as something important is pass-fail. Yes, it is some sort of a luxury where you don't really have to worry about that difference between a B and an A. As many of you already know, getting a B is actually not too hard, but studying that extra amount just to get a few more points to get an A is a pretty big difference and a little stressful. So that is a positive, but being in both situations where it's graded and pass-fail, I'll tell you that in a way the pass-fail environment kind of caters towards mediocrity, and you kind of lose that extra oomph for excellence. And so you kind of have to give and take there. If you feel like with a pass-fail system you can still try really hard and learn, then maybe that's a stressful route. But if you feel like you need a push to really work hard, then you kind of have to consider that maybe a graded system isn't all too bad, and it'll push you through dental school to maybe be able to excel in, let's say, a residency or in private practice as a general dentist. The other thing that I want to mention, the 4th factor that's less important, is class size. I don't see a correlation where a smaller class size means you actually get more attention from faculty. I mean, a lot of times a bigger school will also have more faculty, and so in the end the ratio kind of evens out. So I mean, I think the best number is somewhere in the middle, like 100. So not that important overall. So now let's talk about some factors that I feel are more important that you should consider. Number 1 is clinical experience. Our profession is very hands-on, it's very technical, so having great clinical experience is very important. So one of the things you want to look at is, how's the preclinical experience? Are there lots of videos available? Are there lots of faculty being able to be more hands-on and teach you the right technical and techniques and procedures? Preclinic is important, and how it's done is important. The next obvious step is, when do you start seeing patients? Obviously, there's a big range. Some schools start consistently at 3rd year, while other schools are being able to see patients earlier and earlier, and that definitely expands your time and clinical experience. Besides starting time in clinic, it's also how much density of clinic time. If there's not that many chairs available or that many patients available, even if you start early, it doesn't matter if there's not enough chairs or patients. So those are some questions that you should ask as well. The other thing as far as clinical experience are extramural or external rotations in community health centers. These are invaluable. You're giving back, but also more importantly, these are experiences that will cater more towards private practice experience, and it's different from dental school. It's a great way to learn, it's fun, and you get a great experience working with assistants and seeing more patients in one day. The other thing you want to consider is the variety of procedures available that are taught and for you to see. You don't want to just get stuck in doing prophies all day. You want a good variety in all their specialties and different materials and different insights in how to do things. So other thing that you should consider is research. I know a lot of people don't want to do it, aren't interested, but the strength of a school a lot of time is actually really directed to research. Yes, you can get a great education in school that doesn't do much of it, but the truth is, if a school is heavier on research, it's able to attract certain faculty to not only do research there, but also to teach you as dental students. In order to kind of gauge the research available, a lot of times you can look at the NIH funding. You can see how much money the NIH is giving each school towards research. Obviously, the more money the NIH is giving, the more research is being done, and that gives you a little bit more choices on research and also more impactful research that you can participate. So what's important in parts 1 and part 2, it really corresponds to the overall philosophy and outlook of the faculty, both your clinical and research faculty. And those a lot of times overlap with their didactic as well. So what I mean about this is, in the end, what are their primary goals in dental school? Are they focusing on their own career goals, or is teaching truly a passion for them? And you'll find that oftentimes there's a certain culture at the dental schools. It's hard to really figure out yourself from interviews. You really have to talk to dental students at each school, or even some of the faculty might be able to be honest with you. But if there's a lot of faculty there and they're able to do a lot of great things themselves, but put the effort and teach, that's great. I mean, the reason that I like Michigan so much, a lot of times isn't for all the other great things like their clinic or research. It's the one-on-one interaction with faculty. They're faculty where you can rely on when you need help, faculty that can inspire you to do new things and greater things. That's what you want. That culture is so important that, in a way, it might be the most important factor that you see, is really how much do they care for their students. And for me, I'm very thankful still from the people, the faculty that interacted at the University of Michigan. The last bonus factor that I want to mention is how well the school is in tune to technology. Right now, I think we're in a point of time where we're about to have an exponential growth in being very tech heavy, and you want to see if a school is prepared for that. If their IT team is like 1 or 2 people, you kind of get a little bit worried. Right now, it's more than just electronic health records. It's how we learn in pre-clinic. You want to have great video system where students can see what the doctor is doing, or even in clinic, you want to be able to have a well-run clinic, have everything in order. And having a great tech-ready school will be best able to prepare you for the future and help you learn. All right, guys, thank you for watching. Those are my perspectives on what to look for in a dental school. Good luck.